Thank you very much. Maybe fill in behind the cameras over on this side. Okay. Well, good afternoon, everybody. Welcome. We'd like to thank you for all joining for us here today. I'm John Lewis. I'm the Vice President of Operations at St. Mary's Hospital. We're very excited today as St. Mary's, Dean Clinic, and Dean Health Plan officially come together under one unified brand. Before I get started, I'd like to introduce a few people who joined us today. Start out with Bill Thompson, CEO and President of SSM Health. You could raise your hand, Bill. We have Chris Howard, SSM Health President of Hospital Operations. Chris. Damon Bobright, Regional President of Hospital Operations for SSM Health. Dr. John Rose, Interim President of the Dean Clinic. Frank Lucia, President of the Dean Health Plan. And Craig Summers, Vice President of Clinical Operations for St. Mary's Hospital. I'd also like to thank and acknowledge the members of the SSM Foundation Board of Members. If they could raise their hand just so we could acknowledge them. I know I saw Doug Dittman. If there's others, raise your hand. Thank you for joining us. We're also pleased to be joined today by District 13 Alder Sarah Eskridge. So at this time, I'd like to turn it over to Austin Duru, who is our Regional Director of Mission Ethics and Pastoral Care. Austin?
Thank you, John. Through the course of interaction with his people, God occasionally changed someone's name. It was generally done to establish a new identity that God wished for them to embody. Abraham came to be known as Abraham. Jacob came to be known as Israel. Simon came to be known as Peter. Saul came to be known as Paul. And I would like to add Sarai came to be known as Sarah. A new name does not always mean that the old name was bad or unsuitable. Rather, it signifies a new or expanded role, duty, function, or mission. We do have great parallels in our organization's history and heritage. Here in Wisconsin, there was a deep-seated relationship and partnership between the congregations formerly known as Sisters of St. Mary and Dr. Joseph Dean to ensure St. Mary's Hospital in Madison was built to serve the growing needs of the community. Those parallels have been honored through the years with the names of our Dean and St. Mary's Cardiac Center, Dean and St. Mary's Neurological and Spine Institute, and more. Today, Dean and St. Mary's unite under one name as we become SSM Health, a name that also pays tribute to the long-standing service of our founding sisters in carrying out our mission within the communities we serve. With this change, all of our hospitals, our care centers, our medical group, our Dean Health Plan share in a unified identity. All of the hospitals across our system in Missouri, Illinois, Wisconsin, and Oklahoma are now united under one umbrella. Together, we define SSM Health so that it may be known for, above all else, exceptional care. This will be a remarkable way to show that our mission, our physicians and staff, and our services are all committed to what our founding sisters in the 1800s were committed to, the people we serve. Keeping this in mind, let us pray. Good and gracious God, we thank you for all the blessings we have received in the past at St. Mary's Hospital, Dean Clinic, and more. As we assume our new name, SSM Health, we ask your blessing upon our entire system, but also on all our individual entities, our physicians and staff. Guide our minds and hearts so that we will work for the common good. Teach us to be generous in our outlook, courageous in the face of challenges, and wise in our decisions. Help us to meet one another in joy and to gain many benefits from the wisdom of each individual as we work together. Grant that this name change will be for your honor and glory and for the benefit of all your people we serve. Amen.
Thank you, Austin. So we told you our new name. Are you ready to see our new look? All right. Got to do this right. We're going to count down from 5. You ready? So 5, 4, 3, 2, 1.
Wow, that looks wonderful. And today we have answered the question as to what is the heart of why we're all here. We think of a name. I'm reminded of what William Shakespeare said, and that is, what's in a name? A rose is a rose by any other name. And that holds true in this case in particular. Just introducing a little bit of humor, though, I want to say that our leader, Bill Thompson himself, I asked him if he wanted to be up here with us, and he quickly said, "Do you have another option?" And of course, you know, being the dutiful employee that I am, I said, "You can stand wherever you want." And he says, "Well, I'd rather stand in the back and be closer to the people who are actually more important." And I think that wonderful example of servant leadership in general is the hallmark of our organization, which has over 100 years, as we all know, of history when it comes to a heritage of healing and compassion and kindness, and particularly to those who need it most. Our 5 courageous sisters who came over to the United States of America over 100 years ago with a purpose to extend the healing ministry of Jesus Christ. I think if they were still here, they would be very proud of a lot of the accomplishments that thousands of our employee partners and physicians and affiliates all over the country, but particularly right here in Wisconsin, have done for that particular mission. When you think of our logo, it also has tremendous significance. Our symbol and name help people understand who we are and what we do. The logo, we hope, will operate as a brand mark, almost a seal of approval, a symbol of everything we have stood for. Our goal in developing SSM Health logo is to create a sleek, contemporary design for our consolidated system and build upon the rich identity and heritage that have endured since 1872. We hope the logo marks itself as a representation of the infinity symbol, signifying the range of services that are so comprehensive throughout the many communities that we serve. Our mission, as we all know, is through our exceptional healthcare services, we reveal the healing presence of God. Each of us come to work each day as maybe different people, different backgrounds, certainly different experiences, etc. Yet, we are all one and the same. in the sense that we want the same exceptional care and service for our patients and our community. We also make it a priority to live by our 5 values, whether it's compassion, respect, excellence, stewardship, and community. Our founding sisters took a vow more than 140 years ago to care for those in need. And here in Wisconsin, I'm also very proud to say that we have delivered on that promise. And today we stand before each of you to renew our vow to this community and everyone we serve, that our values and our mission will still be a mainstay in the many, 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 many years to come. So with that, I will turn it over to Dr. John Rose, Interim President of SSM Health, Dean Medical.
Thank you, Damon. And good afternoon, everybody. Thanks for coming out to spend part of your day with us. And doesn't that look sharp? So past and present, we have a lot to be proud of. SSM Health and Dean have worked together for more than 110 years. And as of September 2013, we made that partnership even more official. We're proud to have more than 33,000 employees providing care to people in 4 states, including Illinois, Oklahoma, Missouri, and here in Wisconsin. Here in Wisconsin, we're home to 3 hospitals, a strong medical group with more than 50 locations and almost 800 providers, 2 senior care centers, a health insurance plan, and a pharmacy benefits company. Our entire healthcare industry, with all of its parts, must find ways to deliver better quality care to more people at a lower cost in the United States than we've ever done before. We share the resources that we have here within SSM to be even more efficient and cost-effective, aligning with our value of stewardship, to work hard to keep our patients healthy by focusing on preventive health and ensuring that they have better outcomes through our attention to safety. When we say that we provide coordinated care, we mean our insurance plan, medical groups, and hospitals are working together to avoid duplication and improve the patient experience. By doing that, we operate more efficiently together. We share best practices across our entire system and improve collaboration among our providers and locations everywhere in the SSM network. When I think about how we're working together, and Damon touched on this when he spoke about the mission earlier, I believe that that mission is in all of our hands. As SSM Health cares for our patients and our members, our interactions with them define who we are and exactly what we stand for. We stand for exceptional service and exceptional healing. We take the responsibility of your health and everyone's health into our own hands, and we're privileged to do so. That's why we're proud so many people choose us for their care, and we will work tirelessly and do work tirelessly every day for them. We have 6 mission awareness teams comprised of staff members from all parts of Wisconsin who work hard helping employees feel engaged and connected to our communities through charitable giving, acts of kindness, and service to people we live alongside and serve. It's a privilege to partner with and provide support for more than 100 local community-based organizations to advance the health needs of Wisconsin residents. We recognize that these community partnerships are where real health improvement begins. At SSM Health, we are leaders in developing innovative strategies that provide impactful health outcomes. We'll work collaboratively with competitors and partners alike to improve our community's health and wellness at all stages of life. Today, SSM Health is one of the largest integrated health systems in the nation. As part of it, we're working diligently to deliver on our brand promise, and we are committed to providing an exceptional experience to every patient who comes through our doors every day. Thank you for being with us. I'm going to turn us back over to John Lewis.
Well, thank you, John. I'd like to share with you just a brief story that's very dear to us here at St. Mary's because it really embodies the mission that we hope to live on that our sisters gave to us. So back in 1918, Spanish influenza was sweeping the world, and many healthcare providers were afraid to treat patients, not wanting to expose themselves to the deadly virus. And in the fall of that year, 22 soldiers at Madison's university-based armory dorm contracted the flu. As hospitals refused to treat these soldiers, Sister Mary Fortunata pleaded to her hospital, which was St. Mary's, to take them in. Once they were admitted, Sister Fortunata cared for them in quarantine day and night. Weeks later, Sister Fortunata herself succumbed to the Spanish influenza, and she was just 32 years old. Hundreds of people came to pay their respects, and soldiers were said to have wept at her grave. When announcing Sister Fortunata's death, the paper's headline read, "The Angel of St. Mary's is dead, a martyr to the cause of democracy."
It's that legacy, the legacy of our founding sisters and the Angel of St. Mary's, which we carry on today. Just as Sister Fortunata put the care of those soldiers before her own needs, we continue to keep patients and their loved ones at the center of everything we do. We hold our SSM Health values close to our hearts, and we have long believed in treating the entire person, just not the illness or the disease. Everyone at St. Mary's Hospital, our physicians, our colleagues, and our volunteers, helps define who we are and who we've always been, SSM Health.
So each week we receive a number of letters from our patients and their families, and they express their appreciation and the exceptional and compassionate care that they receive at St. Mary's. The family of a patient wrote a letter recently praising the care their grandmother had received at St. Mary's in her last dying days. The family especially wanted to recognize a nurse with whom they had forged a very close bond. So they wrote, "He was her nurse on the day that she passed. We were there with her a few hours after that, and he came in the room several times to ask if there was anything he could get for us, anything that he could do. For me, I think of one of the most touching things that he said was, and it still brings tears as I write this, 'I am her nurse until she leaves.'" The family of a patient who was about to be moved into hospice care wrote about their mother's nurse. They write, "She looked me in the eye and told me she was not familiar with hospice nursing and had not been trained in hospice care, but she was going to do her best to provide the comfort that was needed. I was impressed that she openly admitted her limitations. However, there was no need. She proceeded to provide the absolute finest, most compassionate, and holistic care my father, daughter, and I received during Mom's stay."
That quality of care is what we pride ourselves on, and it's what we continue to be recognized for. We're proud of the recent honors we have received through both our heart and stroke care, as well as our 5-star ranking for overall hospital quality care from the Centers for Medicare and Medicaid Services, and our inclusion on the U.S. News & World Report's latest Best Hospitals list. Our nursing colleagues are routinely recognized for nursing excellence and are currently working towards a 3rd magnet redesignation, which would place us in an elite group of organizations worldwide. Today, we gather with our medical group and our health plan, remain faithful to the mission of our founding sisters of SSM Health to provide compassionate and exceptional care to every patient who enters our doors. So that concludes our presentation for today. I want to thank each and every one of you for coming. We will be having refreshments down in the Healing Garden, and we would ask everybody to not walk through the hospital, but we do have the doors open. So if we go down here and go to the right down the sidewalk, we'll have refreshments, and thank you.